Hey guys, Dr. Castillo just wanted to quick go over our TikTokers. So anytime a TikToker comes in, we always want to find out, are they there for just the adjustment, kind of the tire kickers out there, or are they out there to actually fix something? Something is really bothering them. So typically, to kind of weed these people out, the tire kickers, I like to start the conversation off pretty normal, like I usually do. Hey, how did you find our clinic? ¿Cómo encontraste nuestra clínica? And then they'll tell me, and a lot of times I already know they're TikTokers, but I still ask it just so that we can start a conversation that's normal. And then I kind of like to call out the elephant in the room, and I go, hey, are you here just for the adjustment, the promotion that we're doing? Or do you actually have something that you want me to take a look at and see if I can help you with? And it kind of sounds like this. Let's say the patient is Pedro. I'm like, hey, ¿cómo encontraste nuestra clínica? Oh, el TikTok. Ok, qué bueno. Normalmente pacientes se encuentran en nuestra clínica por otros pacientes o conexiones de la clínica, pero gracias por conectando con nuestro TikTok. Entonces, la verdad, normalmente hay dos tipos de pacientes con los TikToks. A veces ellos solamente quieren un entrenado y no más. Y eso está bien. Obviamente estoy aquí para servirte y cualquier persona. Con el otro lado, a veces pacientes se encuentran en nuestra clínica por TikTok y ellos tienen algo que necesita atención, que ellos quieren arreglar, si me entiendes. Entonces, ¿qué necesitas en este momento? ¿Estás aquí solamente por el tornado o tienes algo que necesito evaluar y ayudarte? And then I just leave it. So basically what I said or kind of muddled through is, and believe it or not, patients will understand you, even what I just told you now. It's not perfect Spanish, but I'm just trying to get the point across and say, hey, are you here for just the adjustment, or do you actually have a condition that you have or that you want me to take a look at to see if I can help you with? And then I just kind of let it sit, because at the end of the day, they're just going to tell, if you're being super real with them, they're already probably really thankful that you're just there as a Spanish-speaking doctor, or at least you're trying to learn it. They're going to tell you what they want. And some of the times they're like, I just feel like, usually I hear words like, I feel stress or I feel tension. And they kind of play it off as like, that's what they have. And they're just basically there for the promotion. In those instances, typically I'll simply go through my same process. I usually don't take x-rays. And then I'm there just to do the exam, the complementary therapy. And then I have a ton of materials that I usually give them, including business cards, pamphlets, and I usually ask them like, hey, if you know anyone that needs help, let them know about our clinic. We're happy to help, and they can use the same TikTok promotion that you found. Done. And I usually leave them alone, give them a couple of maintenance options in case they want to come back, and I basically kind of just like take it away. And it's funny because these people know about our clinic and they do come back, but they're just there for the tornado. They're not really there. They don't have any motivation to fix anything, which is totally fine. On the flip side, if they're there and they actually want to fix it, that's where we just continue our normal day 1, day 2 process, walk them through how we do the exam, the x-rays, and then we do the therapy, and then we invite them back for a second day so that we can tell them, hey, if there's something that we can help you with, we could definitely go over some recommendations if it's something that you want. And then hopefully they say yes. So just to let you know, that's usually how I frame the conversation. I'm a little bit more blunter with Spanish speakers, simply because I know that it's tough to find Spanish speaking clinics. So I'm kind of like, I basically come at them like, hey, like, we're here to help you. You're either on this side or this side. Which side are you on? And then I just let them talk and treat them accordingly. So hopefully that helps a little bit. Obviously you have a translator with you, you can explain that, but if you're trying to muddle through it yourself in Spanish, you can use the term tronado, which basically means like a turning of, so like, I'll basically say like, hey, ¿estás aquí por un tornado? Okay. Or tienes algo para arreglar. Do you have something to fix? El tronado is basically a slang form of adjustment, and it can be used in multiple ways, but tronado is something that's used kind of like on the street language in terms of chiropractic adjustment. So hopefully that helps you guys. If you have any questions about how to navigate TikTokers, because they are a little tougher in some instances, feel free to ask any questions, and I'm always here to help.